Okay, I'm with Dr. Tom Giammatteo, chiropractor, naturopath, and developer of integrative manual therapy, longtime teacher and friend of mine. I'm Ralph Havens, physical therapist. And this is When Doctors Have No Answer, our podcast. And today I'm going to go straight to what Dr. Tom was talking to me about before we went on screen, which is a really cool thing that happened in one of the classes this last week or so that helped reduce scoliosis and took away back pain. And so I'm going to hand it straight over to Tom. And yeah, if you want to give a little brief description of who you are, but basically you help people heal, and you've been my longtime teacher of integrative manual therapy. But Tom, I'm glad to have you, and I'm ready to hear this story again. This is great.
So Ralph, we just finished our second week of the academic intensive for the Connecticut School of Integrative Manual Therapy. We run a 3-year program that's been licensed by the state of Connecticut to give up the diploma in the occupation of integrative manual therapy. It's a 3-year program broken up into 12 weeks for the first year, for the second year. And in that week, you actually get 1 to 3 different college credits, college courses. They're about 22 hours each of 3 days of intensive, and then we have a 4-day course, and we sometimes have 1-day modules. And so you get about 50 different college courses done in that time. And it's designed to take somebody out of high school and make them a healthcare professional.
I did that training back in the day, and finished it up in 2007, and just kept going with you on the learning.
So it's the, we were first physical therapists, and then I became a chiropractor, and you never stop learning, right? You have all these basic tools. So it's not like when I finish, I'm gonna help people in the world, but always getting more education is something that a good practitioner is always craving for. When they say, I know everything, you know that they're ready to retire. So it was the second week of the program. And we have courses called biomechanics, and another one looking at the gastrointestinal system, how you start to swallow and how you start to process your food. And the course, it was just in the end of January, so winter time and everything like that. And some of the students that we have are nurses, dentists, psychotherapists, body workers, massage therapists, and just people out of school that just want to learn a new form of healthcare. So we had those clients together, and this was about the biomechanics. An IMT, my wife and I coined a name called descended sacrum, and it's a neurological problem that can't be picked up on X-ray. It has to be lightly palpated, and it's probably 75 to 95% of all chronic issues have a piece of the descended sacrum in it, and it's the whole nervous system that gets pulled out of the brain and gets stressed in the back of the head. So
happens after car wrecks and all sorts of accidents, all sorts of things.
Car wrecks, falls, concussions, even birth trauma, because it's too much pounding on the kid's head, are different ways to do that. And in the first week, we talk about how we use fascial leases, and we teach the diagnostics on how to discover things. So next we move to biomechanics, and we have a protocol or a system of looking at every single joint from the lower lumbar to the sacrum to the 2 hip bones called the innominate bones, and even how the front of it works. So we can release the bottom of the spinal cord, the sacrum, and then gently figure out how to push it up.
Tom, is this descended phenomenon? Is anybody else talking about or using something to help in osteopathy or chiropractic, or anybody else using this thing? Or not using our technology, but at least aware of this problem?
To the best of my knowledge, no.
Okay, just wanted to check on that.
And Western medicine has some very harsh ways to work with it. This is the
surgery.
POTS disease that is commonly almost 100% of people with POTS, postural orthostatic hypertension syndromes, polyvagal nerve, some eating disorders like bulimia, anorexia, migraine headaches. So all those can have the same subtone to them. Depends, like one is louder in headaches, another is louder in indigestion, irritable bowel syndrome, Crohn's, all fall into this category. And there's been a big perspective in this POTS relationship that it's an unstable neck and the ligaments that almost the brain slips out of the skull and comes and gets impinged up there. And they're doing neuro scar tissue scraping and going and opening the spine and just scraping things off. And truthfully, you've seen this as miracles too. If you get the tension off with some simple body work, all the scar tissue disappears, right?
Yeah. It's amazing how the body will let go of protections like that if you just take away why it's doing it.
Right. So in the class, we also had a 24-year-old that had a severe scoliosis, and at 10, she had rods put in, and she did. It helped stop the curve, but she's always been in pain. And so for the last 6 months, she's become my client, and she was sent up by another student, and I invited her to take the class for the knowledge of the spine. And she's on the fringe of trying to remove the rods at the same time, but this could debilitate her for 2 to 3 weeks that she's in bed. Her stomach's a problem and everything else. So, and then we had another person in her 70s. When she was in her 50s, she developed a tumor behind her ear. So they actually took out the tumor, but she lost the hearing and had facial palsy. So the right side of the face was a little bit, and she's been a client and a medical professional for about a year now. And I convinced she started taking classes in September with us, and she loves it because it's answering all the questions she never found in her profession. And so both of those clients are there. And then we had a dentist that specializes in jaw pain and headaches, and she makes all these appliances, and she has a good success of helping people reduce the pain from all these pieces. And we started working together. And I promised her, when we got through the biomechanics of resetting the pelvis, the sacrum, and the hips, all down in the low back area, we actually get 80% of our neck range back. And she didn't believe it. So every time we did a technique, I had her check the jaws, and her jaw kept dropping every time. And we got 80–90% of those pieces back.
That's what IMT did for me. I just kept testing myself in that very first class back in 2000, and my body got way better. And then that week, my running was off the charts. It's incredible how good you can feel when you get these kind of things taken care of.
Right. So it's a dance, and it was definitely a beautiful dance that came on. So we went through the class, and everybody was getting these nice spinal movements. The person with the scoliosis and the rods sometimes needs a walker to walk around, and she gets too dizzy and stuff. So, and she can only sit in a chair for 20 or 30 minutes. As we got through the class, she was getting better and better. And we started noticing she had a thing called foot drop, where the muscles of the foot don't actually lift the toes up, and they scrape, and then she can trip and fall. So we started getting more and more motion, and her pain's getting better. And the last technique we teach is that after we balance off the hips and the back, we have to go down the chain of movement and look at the feet and ankles. And we coined a term, which is 2 very light techniques that are beautiful, and I not have known them to hurt anybody in the world. They only can help, and it's called the secret of the subtalar joint. Talar and subtalar joint. And it's a way to put your hands on those bones and gently push down and spread them apart, right? So the bone in the middle, at the top of the foot, is called the talus bone. And then you have your tibia. So you have your tibial talar joint, and below that you have your subtalar joint. And we actually do fascial releases on both of those. they take about 10 minutes. They could last for about a half hour sometimes. And we had finished the biomechanics and we're going down, and we did this 2 light techniques, which you put your hands on and you glide in certain ways. And as they were doing it, the girl with the scoliosis basically said, my stomach's getting better, I'm losing my headache. And when we stood her up, all her muscle foot drop was gone.
All of it. Isn't that
Everybody
crazy?
started crying. So,
Everybody started crying. Yeah. I've had these experiences myself, Tom, and with myself and also with clients. And the other technique that we loved is that bone bruise technique. I did that on a guy yesterday after the run, and he'd been seeing a physical therapist for a long time, and we took away his pain in about less than 5 minutes. It's incredible. There's a part of what you do, what you taught me that we have, that I think is one of the all-time keys to this thing is this myofascial mapping. Because I talk about it like a race car, like, you know, if you think of a race car and it's the driver and it's not going around the track very well, you could give it better gas, or you could maybe clean the oil, and maybe the oil's got some problems and it needs oil change. And you know, that could be like food and water and stuff like that, taking away toxins. If you think the race car driver just has a wacky brain, and you could give him some mindset things and hypnosis and try to change his mindset so he can win. But if the car's out of alignment, if the frame is crooked, if the tires are not right, if the tires are worn out or not doing very well, there's this structural part of things to fix up. And one of the keys with IMT, of course, you know this, but I want you to talk about it, is are you looking in the right place? Like, you know, is this a toxin problem? Is this a some sort of mental, emotional, spiritual problem? Is it just a biomechanics? The bones are just not in the right, things just need to be shifted. You have this thing you've taught us, myofascial mapping, so you can find where to actually treat. You just showed us an amazing result, and one of the keys is to know what to do, because there's a lot of classes. Can you talk a little bit about how to find, like, how did you say it? I forgot, I wrote it down here, but just how to go find the right spot to do the thing to.
yeah. Inhibitory balance testing, we call that, or primary lesion. So the art of IMT is you learn different types of styles of healing, and I call them the golf clubs in your bag. So, you know, if you're gonna use a putter or a sand wedge or a driver, they break up into categories. So you have all these golf clubs that have caused miracles before, and this biomechanical secret of the subtalar joint is like one of the ones that should be taught for a first aid class type of thing, for everybody. Because I don't really see downsides on it unless somebody's got their foot cut off and it's bleeding. You can't do it on something like that. But the mapping is the roadmap of where that person is locked down with. So the example I try to give sometimes, if you have a tight sweater on, it may stop your lungs from fully expanding, and that person may be more susceptible to get a pneumonia because they haven't had the full motion of the breath, right? Or if I hold somebody's sleeve down, I ask them to lift their arm, they can't really do it. It's because the fascia is holding it down. So we see where those are, and we have 3 or 4 different techniques. One is called myofascial release, when it has to be done a specific way with this evaluation, and all of a sudden the person can release and walk away. It's almost like every single spot in a person's body is like a knot in a gold chain, and it makes the chain shorter and shorter, and it's not useful anymore. But do you pull the chain apart, or do you wiggle it and let the knot come undone? So all the tools we have are let the knot
that is part of IMT that's really key, I think, is because I have a client that went to a good osteopath, I think, but she was doing what we call direct techniques, very gentle, but caused some problems. And the osteopath was saying, yeah, it's going to take a couple of weeks for you to like settle down. But she lost some of her function. So the difference is like you said, instead of pulling apart the problem and just trying to force it, there's a way to work with the body and let it unravel itself, which is another
Right.
part of the IMT.
So in that process, the scoliosis person lost her foot drop, and all the other healers in the room said, "I've never seen that before," type of thing. And she goes, "Look, I'm dancing now." Right?
Yeah.
And then when the woman with the tumor that is gone, they needed to do the surgery because there was something that was going to be life-threatening. She was feeling all the pain of her old surgery when we were doing the technique in her ankle. She goes, "How's this connected?" It happened to be the dentist that had the tumor. So, and her jaw opened up better. She could hear slightly better and everything else just by touching something so distant, but it actually connected. And if you look at ancient other studies like acupuncture, could explain some of the acupuncture points that go in the foot and come up to the head too. So it was a day of miracles.
That's awesome, man. Yeah, I remember once Kanoy, one of my therapists back in San Diego, only taken a few IMT classes, but was in the class and was working on a bone bruise in a practitioner's ankle. And she was a Feldenkrais practitioner, so did lots of movement therapy, but she had Bell's palsy. So she was like, had a flaccid, droopy side of her face, and fixing up the bone bruise in the ankle, and her face came up. It's like
Right.
crazy. It's crazy.
Yeah, when you create the right tone in the person, things change miraculously. It's like giving a flower water and it stands up tall again. It's almost like that. And they're both organic materials. They both should help the person the same way, right?
Yeah,
So,
you gotta be looking in the right spot, and you have to have a technique that can help the body unravel it and then protect themselves, and they can get on with healing.
yeah, Ralph, I have a big problem a little bit to say is I'd love to put this on the internet. However, I don't know how to teach touch over the internet.
No, I know. I'm really lucky in that I've taken so many classes. You could teach me over the internet, but so Tom teaches these classes in Connecticut, West Hartford, Connecticut area, IMTwellnesscenter.com. The links will be below. And then I'm on the West Coast. I'm trying to get Tom to move to Bellingham, but we'll see. But
It looks
yeah,
beautiful over there, Ralph.
it's beautiful, man. I'll send you a video today. And yeah, so and I'm at ralphhavens.com. Numerous places to find me and Tom. If you're a practitioner, give him a call, go get on his classes. And I've been to where Tom is many times over the years for classes. And if
It's
you're
worth the trip.
it's worth a trip. If you need healing, or if you know somebody that needs healing that has not been helped with what they've been trying, we like to say when doctors have no answers, it's not blaming anybody. It's just that they haven't found the answer. If you need this sort of healing, reach out to me, reach out to Tom, and we can help you, and we can also guide you. There's other practitioners around the world that have taken these classes, and let's get out there and heal things up. So, Tom, it's always good to see you. Thank you for everything you've done. You've literally saved my life and my family's life, and I just want to thank you. So reach out, everybody. Send me a message. I'll put this everywhere the things are: Spotify, YouTube, Rumble. Here we go. All right. Thank you, Tom. I'm going to turn all of this off, and I know you got to get going too soon. Let's see.